Now let's look at the second question, where it says the arrow points to a bone which will articulate with. So it's not asking you to identify the bone, but it's just asking you to identify the bone in your head. But the choice that you have to choose here is that what will it articulate with. So this, you can see here, is the rib, and the ribs articulate with the vertebral column at the back, so with the vertebra on the posterior aspect, and here through the costal cartilage you can see it articulates with the sternum. So the first choice is wrong, because yes, it is a true rib, but that's not what the question is asking. The second choice, which says it articulates with the rib and vertebra, now yes, it does articulate with the vertebra but not with another rib. Those which articulate with other ribs are what are known as vertebrochondral or false ribs. They are called vertebrochondral, or also known as false ribs. And what they really do is they articulate, and those are the 8th, 9th and the 10th. So this one, and this one, you can see they articulate with the rib above through the costal cartilages. So this one articulates with the rib above through the costal cartilages. So that's why they are called vertebrochondral, because posteriorly they articulate with the vertebrae, but anteriorly they articulate through the costal cartilage with the rib above. Costal cartilage is cartilage, so it's chondral, therefore they are called vertebrochondral. Now this is not one of those, because you can see very clearly it's articulating through its costal cartilage with the sternum, so it's not this. Third one, vertebra and sternum. This is the right choice, because you can see here it's articulating with the vertebra behind, and through the costal cartilage it articulates with the sternum. Quite often we don't say costal cartilage, we say sternum, because the costal cartilage is really the unossified part of the rib. So, it articulates with the sternum. So that's the right answer. And obviously the fourth one is not correct, which says articulates with the rib above and below, because it has to have an anterior and posterior articulation, and you can see here there's no rib, it just articulates with the rib above and below but nothing posteriorly. So therefore that's not a choice either. So therefore the third one is the correct answer to this. And always in your answers be very careful, don't use words such as just spine, because spine typically really means the spinous process. If look, this is the body and that's the transverse process, and here this is the spinous process. When you say spine, that is the spinous process. You must always say vertebral column or thoracic vertebra or vertebra, so as is given here. Now let's look at this one, which asks you to identify the bone that arrow A is pointing to, and then what passes through B. So let's look at this area here. This is what the arrow is pointing to for A, and then B is this foramen here. So this is not the frontal bone. The frontal bone is here. So hence this first statement, this is wrong. And the second one is also wrong, because the inferior alveolar nerve and vessels, these are not present here in the skull. These are present in the mandible, in the mandibular foramen. So in the mandibular foramen. So therefore this is not a choice. Now let's look at the second one, which says sphenoid, and then it says what passes through B, and it's foramen magnum. So there itself you can right away say no to this, because foramen magnum is an aperture, is a foramen. So we are asking what passes through it. So here it's not telling you what passes through it, instead it's naming a foramen. So not only is the answer wrong there, plus in any case the identification is wrong, because A is not the sphenoid. The sphenoid is this part here. It's a bat-shaped bone, so you can see here. So it pretty much goes this way. So all of this is the sphenoid bone. So it's not the sphenoid, and foramen magnum is this aperture. So it's not that answer. Let's look. So these two are wrong. Let's look at the third one, which says ethmoid. Yes, this area is the ethmoid, and this area is called the cribriform plate of the ethmoid. Laterally in the center is what is called crista galli. So yes, it is the ethmoid, and this canal here is the optic canal, and what passes through B is the optic nerve. So this is the right answer. So again, to show you, this area is what it is pointing to is the cribriform plate of the ethmoid, so ethmoid bone, and this canal is the optic canal, and optic nerve passes through it. So that's the right answer. And let's look at the last choice also, where it says occipital and vertebral artery. Well, this is the occipital bone, this one here, or rather this whole bone up here, this, like, you know, going this way, is the occipital bone. So, and this this part is the occipital bone, and this is posterior and this is anterior. So you can see how huge this bone is. So it's not the occipital bone. And vertebral artery is one of the structures that passes through foramen magnum, and this is the foramen magnum. So of course this is not this, so therefore this answer is not correct. Now, by looking at this question, what you should see is you will get questions where you may be asked to identify either the foramina, or you may be asked to name structures which pass through the foramina. Now, suppose it just says name one structure which passes through the foramen, you obviously can name one structure. But when the question asks you name the structures which pass through this foramen, then you must name all the structures that you know which pass through foramen. Now, for example, as you can see here, inferior alveolar nerve and vessel. So, you know, let's say you got the mandible and you were asked about mandibular foramen. You must talk about all of this. Or intervertebral foramen, you know, you talk of spinal nerves and vessels. So don't just write one structure, but write all the structures that you know. So that's really important, and that is what will give you maximum points in the test.